Welcome to Danielle Smith's Fraser Forum. This program is part of a series of podcasts doing in-depth interviews on free enterprise and personal liberty. I'm your host, Danielle Smith, president of the Alberta Enterprise Group. Go to fraserforum.org where you can subscribe, comment on the program, and see links to the studies we discuss. You will also find archives of previous episodes. Our email address is danielle@fraserforum.org. We'd love to hear from you.
There's a lot of employment in the service sector, and that's what's been disrupted a lot. Some of this might be permanent. I mean, a lot of people, might decide they're fine cutting their own hair 2 years down the road. I mean, I've had to be rather innovative over the last year, and I'm sure a lot of other people have.
I'm Danielle Smith, and I'm joined now by Professor Livio Di Matteo. He is a professor of economics at Lakehead University. He's been doing quite a bit of work looking at the impact of COVID and COVID restrictions. And his latest work is Global Storm, the effects of the COVID-19 pandemic and responses around the world. And he joins us now to discuss what he has found. Professor, thank you so much for being with us today.
My pleasure. Good day, Danielle.
Let's begin by putting this in sort of a global context and how you framed your approach to this study. Because I think that there's this impression that all you needed to do was lock people down, put masks on, social distance, and that would reduce the amount of hospitalizations. It would reduce the amount of people going into ICU. It would reduce the amount of deaths. And so I suppose if you were just looking at those statistics, it would have been a pretty easy measure. Are those the stats that we should be looking at? Or are those the measures that made the most difference?
Well, the entire pandemic and the response to it is fairly complicated. It was a global phenomenon. The study itself looked at up to several hundred countries, depending on the availability of data. And it sort of mapped out, the incidence of the pandemic in terms of cases per million, deaths per million. Then it also looked at the economic impacts, some of the fiscal impacts, etc. So it's fairly comprehensive. And as a part of this, some statistical analysis was done looking at what determined cases per million, deaths per million in terms of variables that may have been influential in determining the extent and severity of the pandemic, as well as the mitigating factors. So in terms of the factors and the responses to the pandemic, a couple of variables came out as statistically fairly important. The first is testing rates. Basically, countries that had higher testing rates in terms of tests per million seem to have done better in terms of catching cases and reducing mortality. And so essentially for every 100,000 tests per million that were done, you were looking at quite a few fewer cases, something like, and also 21 fewer deaths per million. And so, I mean, that adds up as you ramp up the testing. Another important determinant of the mortality rate is the proportion of your population over age 70. And so countries that are, in a sense, older were hit much harder by the pandemic with a higher mortality rate from it. And so the study itself is confined to simply 2020. I mean, the data is for essentially from about January, February of 2020 to the end of December, early January of 2021. So it's just those 12 months. So in that time frame there, the countries that were hit very hard initially were actually a lot of the advanced economies, the International Monetary Fund, IMF 35, if you'd like to call them. And those countries tend to be relatively older than other countries. You're looking at the proportion of the population over age 65 to 70 in the double digits, 14, 15, 16%. The rest of the world actually has a much younger demographic profile, particularly in the less developed countries. And so they were not hit as hard at first. they've featured more prominently out in the second and third waves moving into 2021. But in 2020 itself, the front end of the pandemic certainly hit the developed world quite hard. And so deaths were significantly correlated with that. In terms of another important mitigating factor, it turns out that hospital beds per thousand population were actually fairly important. And so if you look at the statistical results from some of the regressions, essentially each additional bed per thousand population was significantly correlated with about 31 fewer deaths per million population. So many people will say, well, an extra bed, 31, per million, it doesn't seem like a lot, but you have to realize that there's quite a variance in bed numbers, particularly even amongst the advanced economies. So the advanced economies, for example, range from bed highs of about 13 beds per thousand population to just over 2 in countries like Denmark, Canada, etc. So Canada, out of those 35 IMF countries, ranked 32 out of 35. It had some of the lowest bed numbers. And so if you think of the mortality tally in Canada in the first year of the pandemic, you're looking at about 500 deaths per million. I mean, if you had bed numbers closer to Japan's, all other things given, you're probably looking at, several hundred deaths per million fewer than was otherwise the case. And many of the deaths in Canada also, about 70% were in long-term care retirement home settings. And so again, that's a function of Canada has a relatively older population. It's a function of the degree of protocols, et cetera, that were in place to prevent infection in those settings. But when push came to shove, there was also not enough hospital beds. And each of the waves of the pandemic, even in Canada, has featured restrictions in part to keep case numbers down because of the fear of overwhelming the infrastructure or the capacity. So, I mean, it's a complicated story. Canada overall, among the IMF 35 countries, if you look at its performance, it doesn't seem to do that badly, actually. It tends to be in the bottom third in terms of cases per million, deaths per million. It seems to do reasonably well. However, it depends on your reference group. I guess one of the most important lessons to learn from the pandemic is that it's important to learn from a pandemic. And Canada, in a sense, had a dry run for the pandemic, along with about 30 other countries in the world. This was the first SARS epidemic in circa 2004. And of those 30 countries that had some cases of SARS, 5 were particularly hard hit with more than 100 cases. And those countries include China, Hong Kong, Taiwan, Singapore, and Canada. And so after the SARS pandemic, many of those countries appear to have undertaken measures to enhance their response for future pandemics. Canada also had numerous studies and panels convened and plans drawn up. But in the intervening time from 2004 to the present, we seemingly quietly deactivated our global public health intelligence system, which was actually one of the best in the world. We allowed our stocks of personal protective equipment to run down. And even when the pandemic began, we seemed to be relatively slow off the mark in securing borders or in recognizing the severity of the pandemic. And that is a factor also in why the toll hit us as hard as it did.
So I wonder why this is I'm going to return to a couple of the issues about the type of, I guess they call them non-pharmaceutical measures that are taken.
My bit on SARS, actually. Can I just finish up my bit
Yes.
here, and then we can talk about the non-pharmaceutical measures. I mean, my point is the following. Of those 5 countries, Canada had 500 deaths per million. The other 4 of those 5 heavily impacted countries, the deaths per million ranged from just under 1 to about 22 deaths per million. So they appear to have learned the lessons of SARS and implemented their plans much better than we did. So, I mean, that was the point that I was trying to make there, if it was somewhat roundabout.
Well, I guess I wonder if it's possible, was it that there was a broader circulation of the virus in those 4 other nations besides Canada? Canada's SARS outbreak was really isolated to Toronto, and I think that there's been
Well, they
some
were hit
studies.
harder also. Canada had several hundred cases in the end, largely confined to Toronto. Okay, these other countries, there were many more cases. I think China had something like 8,000 cases during that particular episode. So they only 5 countries had more than 100 cases. We were one of them, at several hundred, and those other countries did have more cases. But nonetheless, I mean, if you sort of recall back to that period, it was actually quite traumatic even in Canada that this was happening, because there was quite a few deaths from it too.
Okay, let's then talk about I think the takeaway a lot of people are going to have from COVID is that all you need to do is lock people down, put a mask on, and keep social distance, because that's what our politicians kept telling us. And I just find it interesting that that didn't emerge as an important factor in your research. So, was it because it was impossible to get the data to be comparable? Or is there some other factor that, because I think that if we're going to learn the lessons of COVID, we need to make sure that we're doing more of the right things that will reduce hospitalizations and deaths and not be diverted into sort of political answers. And so, can you comment on that?
Well, I mean, the response is multifaceted. This was a new virus. And so the initial response, in many respects, in the absence of a vaccine, is not much different from, a medieval plague. I mean, some type of physical distancing, quarantine measures, face coverings. I mean, those are all appropriate tools. The lockdowns seem to have an effect on mortality and case numbers, particularly in the first wave. Those ones seem to be particularly effective. It's the protracted lockdowns that seem to be more difficult. I mean, as the protracted lockdowns continued, I think a lot of people became more comfortable living with the pandemic. They basically did not follow the rules as much. And so, in a sense, a lot of the rules were almost voluntary in terms of compliance. And so, the protracted lockdown was less effective. I mean, the best way out of the pandemic, obviously, is to have vaccines. And that did not emerge till almost the end of the first year. So, given that you have not a large supply of hospital beds, there's no vaccine, really, in a sense. Protracted lockdowns seem to be the only tools left. We were also short of PPE, particularly in the first few months of the pandemic. And so the lockdown's a fairly blunt instrument. It can work, but they have to be short, sharp, and enforced. And the first lockdowns were also effective because people were more afraid. And so I think there was a lot more compliance, but as time wore on, they became less fearful, took more risks, and that has been a factor. And I think more work will emerge on that as time goes by. I mean, in a sense, this particular study is very preliminary. It's the first year of the pandemic, and as time goes on, more and better data emerges, in a longer span of data, more complete data. I think we'll be able to get a better handle. I mean, the report itself did not focus specifically on lockdowns as a restriction measure. It was the Oxford Government Response Tracker. So it's an index from 0 to 100. The bigger the number, the more restrictive. And lockdowns are only part of the sort of set of variables that's used to construct that index. So the stringency in general, seeing higher levels of stringency earlier on in the pandemic, seem to be more effective. Later on, they seem to be positively correlated, and that's because very often as cases rise, you ramp up stringency so the variables move together. It's only at the very beginning where the stringency seemed to have gotten ahead of and brought down the cases and the mortality numbers.
All right, let's then talk about the measures that you did find to have a strong impact. So, first of all, the issue of testing. And testing's been a bit controversial because in the past, whenever we have had, say, an influenza outbreak, we normally only test people who appear with symptoms. And so, when you look at the difference between jurisdictions and they were reporting case numbers, oftentimes it came down to, well, how much testing are you doing? And are you identifying cases of people who are sick with it and infectious, or are you testing people who just have remnants of the virus turn up in their blood? And yet you found that to be a very strong correlation. So why would that be? The more testing you do, the better your outcome was when you're looking at some of the other measures.
Well, if you test people, you discover the cases, and then they can be quarantined or self-quarantined so they don't spread it. I mean, if the pandemic was, if the symptoms were more obvious, it would have been easier to contain. The original SARS, I mean, the people who were infectious, it was obviously ill, whereas there's a lot of asymptomatic spread this time. So more testing, of course, could identify more of the asymptomatic cases. And so that basically allows you to, in a sense, nip things in the bud before the problem gets larger. So more testing, basically a greater spread of the testing was very useful in sort of containing ultimately cases and of course the mortality from those cases.
I wonder if you can get granular in Canada. And I don't know if other nations are like this, but you've mentioned in some of your other work that part of the issue we have in Canada is our healthcare system and the issues of testing would be driven by the provincial level. And it was quite a bit of variation between provinces and how much they were testing and how quickly they managed to get that together. Is Canada unique that way, or are those confounding factors in other jurisdictions as well?
Well, one of the results or variables examined in the report was there something about federations or countries with federal arrangements that somehow affected either the response or the outcome. It turns out federations internationally did not seem to have worse outcomes, statistically speaking anyway, than non-federations when it came to cases and mortality. But if you look at some of the worst hit countries, the United States, Brazil, India, in terms of total case numbers, those are all federal countries. And so even though on the surface that seems to be a relationship, statistically, that did that not seem borne out. Within the IMF countries, again, there does seem to be a difference. Within those 35 countries, the 8 or 9 countries that are either more devolved or are official federations did seem to have somewhat higher mortality rates, more cases. And so one starts to wonder if differences in countries that have a more uniform jurisdiction did emerge. And so again, I think that's more something that will be examined in more detail in the future. The Canadian case, of course, yes, you have health is a provincial responsibility. And although there's a lot of similarities in general in health outcomes across the Canadian system, even though there's 10 provinces, in the case of the pandemic, each province did have somewhat slightly different, I guess, approaches to testing and the measures that they implemented. And for the most part, that's a good thing in a federation. I mean, one of the advantages of a federal form of government is that, in a sense, it allows for, I don't know if experimentation is the right word, but sort of different approaches. And from that, a sort of best practices can emerge. So, I mean, early on in the pandemic, the Atlantic provinces seemed to do best in terms of containing the pandemic within Canada. And so one would think that there might be some lessons there. On the other hand, there's also differences across the provinces. Some are much more densely populated than the others. And I mean, I think that's a factor. And, Canada as a whole, within the world, one of the reasons, we did as well as we did, all other things given, is partly I think our low population density and the
Mhm.
dispersion of our population. Like we like to think Vancouver and Toronto are these large cities, but really even Toronto, once you get outside of Yonge, Bloor, Spadina, and King, it's very low density. Toronto is actually a very spread out, low density city. It's not Mexico City. It's not Shanghai.
Mhm.
Um, and so I think, in a sense, Canada did better, all things given, because we are a relatively more dispersed country. And we're dispersed politically, we're dispersed geographically. And so that may have also affected our response. The federal government, essentially, health is not a federal responsibility except in certain narrowly defined areas. And so that was left to the provinces. Even in terms of vaccines, I mean, the federal government undertook the procurement role, the provinces did the disbursement role. And so even there'd be differences across the provinces, etc.
I will want to get you to draw some conclusions about where we should be looking in Canada as we're trying to tease out the differences between the provinces, because I think this is important. Because I was watching these stats all the way through too, and Quebec was dramatically worse in the death rate compared to the Western provinces. And so I'm interested in knowing. Well, I know right now we're looking at national data, but I think we're going to have to do some more detailed work and understanding what the differences are in our provinces to understand why it is the death rate was so much higher in Quebec than it was in the rest of the country, and particularly in some of the smaller Western provinces. And I guess you'd probably also say Atlantic Canada. But maybe the next measure that you looked at, I wonder if this gives any indication at all, because you talked about hospital beds also being a factor related to the performance of how a nation did. And explain that to me, because I guess here's my starting point in thinking about that. By the time somebody is sick enough to need to be hospitalized, that can actually increase the likelihood of them having a bad outcome. So it would seem to me that if you had more people in more hospital beds, sicker people, you'd probably end up doing worse. And yet, the idea of having more hospital beds sounds like it was a mitigating factor. So, can you piece that together for us so I can understand why that might be?
Well, if you have more hospital beds, when people get more ill and require ventilators or an ICU, they'd be more available. And in Canada, the hospital beds per thousand population across the provinces doesn't vary that much. You're looking at about 2 beds per thousand to about 4. I think the largest number of hospital beds per thousand population is in Newfoundland and Labrador.
Hmm.
That's closer to 4. So there's that range, but even that range is at the lower end of the IMF countries. So if you look at where all the deaths have been, I mean, in Quebec and Ontario in particular, they were harder hit by deaths, but a lot of those were in long-term care homes and retirement facilities where people are more crowded together, particularly if the residents were in wards of 4 beds. And so in Ontario, one of the things that appears to have happened as the year has progressed in 2020 is that those bed numbers, those beds were basically, those rooms were converted to 2-bed wards from 4. But what that's also done is exacerbate the shortage of long-term care. I mean, in Ontario, long-term care beds were about just under 80,000 or so, 78,000 about 15, 20 years ago. About 3 years ago, they were still at that. And then with the pandemic, they've actually had to take beds out of circulation in order to basically allow 2 people to a room, particularly in many of the older homes, which still had more wards. All the newer homes that have been constructed over the last 5 to 10 years all tend to have, single rooms or at most 2 residents. So if you had an old stock of long-term care homes, retirement homes, sort of, built 40 or 50 years ago or 30 years ago, that is probably not this was not in the study. Please, just fully understand that this
Well,
is
as I say, I'm just looking to see if
data.
you can give us some advice on what we might look to
Well,
next. And this does seem to be like a fruitful area of future
oh,
research.
no,
So please continue.
I think there's going to be a lot of work that has to be done. Exactly, what happened there. So even as people became ill in the long-term care homes, it would appear that a lot of them didn't make their way to the hospital. And I mean, you can ask what are the reasons for that. I mean, the current wave, this third wave in Ontario, you've seen the hospitals come even more stressed than they were during the first wave. And part of that reason is that the first wave, in a sense, hit the elderly, particularly those in long-term care, very, very hard. By 2021, most of them had been starting to be vaccinated. So when this third wave came, it did not impact them as much, but it did impact the younger demographic. And unlike people in the long-term care homes who may have ambulatory or cognitive issues, people under age 50 who are mobile, if they're feeling ill, they're going to go to the hospital. And I think that was an element of what was going on. That is, the virus spread and the new variants start to take hold, and a younger demographic was being affected. They were picking up and moving and going to the hospital. And so that sort of exposed the shortcomings of inadequate bed stock even more in terms of the hospital sector.
It does strike me that if you do have, I'm trying to connect this to the data that you did look at, if you also do have a greater stock of hospital beds, when somebody in long term care does get ill, you can move them to the hospital and keep them in the hospital. I think one of the issues that we had is, especially we saw this in New York, that those who were positive with COVID were actually being pushed out into long term care, which was increasing the spread. And I don't know if we've got good stats on that. Are there any statistics out there on the extent to which a jurisdiction did a good job of keeping COVID out of long-term care homes? Because I bet that there's probably a very strong correlation between those two factors, that if the lower the incidence in those congregate care settings, probably the lower overall death rates. And I don't know if we keep consistent statistics across jurisdictions for that. Were you able to find anything like that?
I didn't really examine long-term care home. I mean, just from what I know, even within the provinces, there's quite a variable performance even across the long-term care homes. I mean, Ontario is just over 600 long-term care homes, and about 60% of those had no deaths, even in 2020. And the other 40% that had deaths, again, some had a few, and then there's, it's quite what's called a skewed distribution. There's some homes that had quite a few. So the first lesson there is you have to look at that data and find out why some homes seem to have had, concentrations of mortality and others did not. And that may be related to staffing, that may be related to the vintage of the home in terms of the whether there were wards or not. But that is certainly something that I think health ministries across the country will probably be examining in great detail in years to come.
Let's then talk about the connection between the reaction by a particular jurisdiction and the impact that there's been on overall economic performance. It's a difficult conversation to have because I think no politician and no economist wants to be in a position where you're looking at trade-offs between human life and economic performance. But I look at economic performance as being an indicator of the underlying health of the economy. And we do know that there's a strong incidence of health conditions that emerge if you have unemployment. There's suicides, there's depression, there's long-term poverty issues. And so I know it's an imperfect measure to be looking at the performance on health measures versus GDP measures, but I just wanted to use it as a bit of a proxy to know if we're going to have long-term future consequences in health. Is that a fair way of putting it on the table, or would you describe it a bit differently?
Well, I looked at the impact of the pandemic on GDP. I didn't really look at the impact of sort of GDP on the pandemic per se. I mean, most countries saw actually their economies shrink.
But may I ask,
Most of
Professor, I
them,
guess before I get into it, I'm just wondering, why does GDP matter? Because I think there will be those who will say, well, when you're talking about health, sky's the limit, GDP isn't even a consideration. Why should we be concerned about GDP in this context?
well, GDP ultimately is what pays for healthcare. I mean, if your economy is disrupted, not only is there unemployment and people don't have an income, but there's also the tax revenues and the resources that are used to provide healthcare. So I mean, GDP and healthcare, in a sense, do move together. Um, However, some of the measures that might have been taken to sort of slow down the spread of the pandemic through restrictions did have an adverse effect on GDP, at least in the short run. Most of the fall in GDP, it's kind of interesting when you start of looking at the effect of cases per million, deaths per million on real GDP growth. Much of the drop occurs as soon as the pandemic hits. And, the first, say, 20,000 cases per million up to about the first 500 deaths per million. And after that, there really is no more effect. I mean, the hit is early on, and then it sort of stays there. And so what happened, of course, is that, the economic shock was quite severe in the first 3 months. Annualized, you're looking at, drops in GDP of 20 or 30%. But then as the pandemic went under control, economies rebounded. And so in the end, the drop in GDP in 2020 was not as pronounced as you might have thought it was going to be in the first 3 months, but it was still significant. And the drop in government revenue in particular, of course, was also a factor in the size of the deficits that were then incurred.
What should we be looking for as we go forward to look at the strength and health of economic recovery? Because I think one thing people are questioning is whether some of the lockdowns and restrictions are going to result in permanent job loss, permanent business closures, and we're going to see a permanently low level of GDP? Or do you have some creative destruction that businesses that were on the verge of not doing particularly well, they went out of business, but that frees up resources so they can be redeployed elsewhere, and then you end up with a roaring 20s type of situation where maybe economic growth is even accelerated from what it would have been. What factors should we be looking at to determine which way this is going to go?
Well, those are all very good questions, and I don't know if I really have an answer as to what's going to happen. I don't think GDP is going to be permanently lower. I think the economy will recover. I think if you look at some of the indicators, there's going to be a lot of pent-up demand for all kinds of things. I think you are going to end up with a bit of a large pandemic rebound, and that will certainly drive the economy forward. In the longer term, though, there's a number of issues. The first is the disruption to the educational system over the course of a year and a half. And, even some of the historical studies that have been done and some of the studies that have been done by the OECD are forecasting that the growth rate may be permanently lower. That doesn't mean the economy is going to shrink. It's just going to grow at a slower rate because of the disruption to human capital, to education among so many people in the schools. Then there's people that will have withdrawn from the labor force. There's going to be a lot of businesses that, in a sense, weren't able to hang on, in which case you're going to have fewer businesses. Basically less opportunities for entrepreneurship to be practiced. And so that could have a long-term effect. Even people that have had COVID, there seems to be a phenomenon known as, the long haul symptoms. That also occurred apparently after the Spanish flu. There were some people who, even the ones that recovered after the Spanish flu, in a sense, were never as healthy. And so that affects your lifetime earnings, your ability to earn an income. So I think some of these types of things are going to emerge in sort of over the next 3 to 4 years as also being significant factors in slowing down growth. Then you have the fiscal factors. I mean, all governments around the world have taken on an awful lot of debt. And so the question is, how much of an impact will that be on future growth, particularly if you look at the supply shock and then pent-up demand coming in after the supply shock, if there's a burst of inflation, will it be accommodated by monetary authorities and lead to inflation, which then, of course, will lead to interest rates going up? I mean, these are all variables, and it's difficult to look ahead and know exactly what's going to happen. I mean, personally, I think there is going to be a recovery. I think the first year after it will be fairly robust, maybe even the first two. But then after that, given that we were already in a sort of slow growth environment prior to the pandemic, I mean, we were looking at real per capita GDP growth at about 2%. Given that we were already in a slow growth environment and some of these other long-term factors that reduce growth further might kick in, then yeah, that's a bit of a problem given the the debt load that countries have taken up, and it will certainly be challenging, I think, as you move about 5 to 10 years ahead.
You also looked at it wasn't an even impact on every sector either. There were certain impacts that were felt more harshly in certain sectors. Is there any area of the economy that was hit particularly hard that is a major driver of GDP that is going to be going to have a huge impact on government's ability to earn revenue in the future?
Um, I didn't really break it down to that extent. I mean, the sectors that were hit very hard were personal services. Uh,
Hmm.
any type of activity that required personal interaction of some type, where people coming together, uh, arts and culture, food and accommodation, all these sectors were hit very hard, and these sectors over time have become much more important. Um, 100 years ago, economies were largely goods producing oriented. Uh, the more developed economies now have shifted to services and away from goods production. I mean, goods production is still as important in these economies, but there's a lot of employment in the service sector, and that's what's been disrupted a lot. And so some of this might be permanent. I mean, a lot of people, might decide they're fine cutting their own hair, 2 years down the road. I mean, I've had to be rather innovative for, over the last year, and I'm sure a lot of other people have. And so even things like eating out, and some people have discovered that skip the dishes is what they prefer to do. They don't want to go to restaurants anymore. So
Hmm.
what do you do with a lot of the brick and mortar establishments if people decide they're not going to go back? I mean, I think in the end, human beings are social animals. People likes to be with other people. I mean, it is going to be a few, months of adjustment, maybe a year. But once it looks like the pandemic is firmly in recess, and that's starting to look more and more likely, although, I mean, with variants, we're still not fully out of the woods yet. But I think as once people get more comfortable, people will return to, theaters and concerts and events because, well, that's what people do. I mean, uh, I mean, I always used to marvel that sometimes talking to my students, they seem to think that watching a movie on a device this size was a meaningful experience. I mean, I always thought a movie should be viewed on a big screen, and there's sort of this energy from people in the audience laughing. And I think as time goes on, we'll definitely get back to that. So it's important to be optimistic, and I think you know how it is. The world will move on. It always does.
Well, truly it does. I have a lot of confidence in people being able to adjust and economies being able to adjust and entrepreneurs being able to adjust. I'm a little more concerned about governments being able to adjust. And I wonder what we need to be thinking about in the context of just how much money our Canadian government borrowed. Just how deeply in debt are we? Because we kind of get the sense that, well, it was a pandemic. They needed to put this amount of dollars out to make sure that they could ease the way through until we got to the other side of it. But was our experience in Canada the norm? Did every country do what we did when it came to the kind of borrowing and debt load?
A lot of countries ran deficits. Um, Relatively speaking, Canada probably ran larger deficits than others. The study also looks at the difference between what the model says should be your predicted deficit and what the actual deficit was. And ours was probably 4 to 5 percentage points larger than
Mm,
one would have expected given the actual severity of the pandemic. It's not that Canada was at the top in terms of deaths and case numbers per million. Within the IMF 35, we were in the bottom third, and yet our response was really quite large on the fiscal and stimulus side. So there may indeed be some overreaction on the part of governments in Canada. And if you look at the savings that Canadians have accumulated over the last year, some of that was obviously because, well, there were no opportunities to spend. Some of it also was all the income support, wage subsidies, assorted payments. And so, I mean, the government did spend a lot. I think in the first half of the pandemic, first half of 2020, so to speak, I think a lot of that was warranted. There was a lot of uncertainty as to where things were going. And so that type of support was necessary. Tapering off the support is probably something that should have begun a little earlier once the fall hit. I think that is going to be a bit of a concern. If you look at the federal government's most recent budget, by 2025, you're looking at a total net debt of something like 1.5 trillion or something like that, and that's just federal. I mean, then you can add the provinces. The municipalities have done fairly well. I mean, believe it or not, municipalities over the last few decades have developed this interesting habit of always running what they call them positive variances. I mean, people would probably get more alarmed if they said there's a continual surplus, but they tend to run positive variances. And even during this pandemic year, most municipalities were all busy saying, oh my, we need support. And more than not, most of them are showing for 2020 positive variances. They, my own city just about 6 months ago said the positive variance looked like only $1 million, and now it finished off at 4.1. So a lot of the support that came from the province and the federal government to the municipalities is going into their reserve funds. So to me, that suggests that they may have provided a bit more than was necessary there. So I mean, this will have to be sorted out indeed over the next year or so, in terms of, I'm sure there'll be studies on, and economists will probably do them, as to how much support was too much, what support missed the mark, etc.
Well, I guess the other part of it is that if there is a resurgence in the upcoming respiratory virus season that we know will happen in the fall, that it seems to me that the government's levers to be able to address it the same way are greatly diminished. I don't know that we have the capacity in our economy to spend another $600 billion in order to see through whatever wave we might have. And so I guess I'm wondering how concerned should we be about debts and deficits? There once was a time back in the 1990s where it didn't matter what political stripe a party was, or whether it was provincial or federal. Everyone came to the consensus that running balanced budgets and surpluses was the thing that we needed to do. We almost hit the debt wall in 1993, 94. And I guess something's not computing for me, because it strikes me, how can you double the amount of debt at the federal level and no one's talking about the potential to hit a debt wall? What am I missing about what's happening this time around?
Well, it's a matter of degree, so to speak. Right now, the federal debt to GDP ratio is at about 50%. And when we hit the debt wall, interest rates were higher, and the debt to GDP ratio is about 70. However, if you add provincial debt, then the total indebtedness in Canada starts to get closer to 90%. And again, you're able to carry it because interest rates are low. I mean, if you go back to the early 90s, 1/3 of every revenue dollar coming in was being used to service the debt, because interest rates were high in the 80s, and they were still high in the 90s relative to they are now. So in a sense, the decline in interest rates has afforded this fiscal dividend. And basically, governments have used the low interest rates to take on a lot more debt. And as long as interest rates stay low and they don't add to it as much, the debt, the situation will probably be manageable, at least in the short term. If interest rates start to go up, that's when I think things are going to get much more difficult, given the amount of debt that's been acquired. I mean, it's a large stock of debt. In absolute terms, as a share of GDP, I guess you can make the case that, well, federally it's only 50%, but it went, from just over 30% to 50% in a very short period. And so a similar type of response, again, bringing the federal debt to GDP ratio to 70 or 80% brings it back into that territory of the debt wall of the early 1990s. And if interest rates, go up even a couple of percentage points, that would be major. I mean, going from 2% to 4 is percentage-wise a very large increase, you see. And so it basically doubles your debt service costs. So that then takes resources out of other things and is a major problem.
It is. So at least you've satisfied my anxiety that at least one level of government is not in these dire straits and adding to the problems. The municipalities, by and large, seem relatively healthy, and I think they've just got rules-based budgeting that limits the amount of debt they can take on and how much interest charges they can have. So that's good news. But talk to me a little bit about Ontario, because when I look at the country as a whole and our ability to recover, Alberta is obviously one engine, but the main engine is Ontario. And do they have, are there some warning signs that we should be concerned about with their level of debt load and their capacity to return to normal on GDP growth?
Well, Ontario has been hit fairly hard by the pandemic. Something like 80% of Ontario's exports, if not more, go to the United States, for example. So the border restrictions have been hard on the Ontario economy. The tourism sector has been hit very hard, particularly in Southern Ontario, because of the cross-border travel again. So those are all aspects of it. The other factor, though, is that Ontario, for the longest time, did have slower growth. Its per capita GDP growth basically has been below the Canadian average for the last 2 decades. The last couple of years, it seemed to be sort of improving somewhat, but because of that sort of longer term performance, Ontario has also acquired a fair amount of debt. And so Ontario now is also approaching, if it's not already there, I don't have the numbers at my fingertips, but I mean, I think after Newfoundland, Ontario has the next highest debt to GDP ratio. Quebec is actually bringing its debt to GDP, or was at least prior to the pandemic, bringing its debt to GDP ratio down. So Ontario, which is the largest economy within the Canadian Federation, the largest province in terms of population, you're looking at a key driver, low productivity growth, a fairly high debt load. Yeah, that is a concern in terms of how Ontario is going to respond. And a lot of the wealth generation in Ontario over the last 5 years has basically been in real estate. It's really an odd situation, but there's run up in housing prices in Ontario, when a lot of your GDP is being generated by the real estate sector. And we're not even talking, construction so much, just buying and selling of homes. That is not a source of productive long-term growth. I mean, you're looking at improvements in output per person. You're looking at rising per capita GDP. This is, a giant wealth effect. It's great if you have a house in Toronto right now and bought it around 1990, but it's not good. I mean, how does a city like Toronto attract young talent, compete for talent, if people even at the upper end professionals, all they can afford is like a 400 square foot condo. I mean, and even those are starting to get rather pricey. So, I mean, I think that's a long-term problem for the sort of what's called the Mississauga conurbation, that's sort of stretched from the Oshawa all the way down to St. Catharines. And in a sense, people might be pleased at the increase in the value of their homes, but I think in the long run, it's really going to hurt the economy of that region, because people just can't afford to live there. Even rents are really quite high. And so how do you address that? And in the long run, the way you address that is through supply. Because what's happened over the last 30 to 40 years is between regulations and policies that have restricted supply, increases in population, low interest rates, a rise in incomes over time. Demand has gone up, family unit size has gone down. Something like the most common household now in Canada is a single person household. So basically, your housing stock is more likely to have one occupant than a family living in it. So, I mean, all of these factors are all demand side factors. And at the same time, we restricted supply. And so, an important long-term policy is what do you do to boost supply? And so, in Toronto, basically, it's either a single-family home or a condo downtown. It seems like there's
Hmm.
nothing in between. If you go to a lot of European cities, they have these sort of condo apartment style type residences that are 3 to 4 stories, often built around a little courtyard and green space, right on a busy street. And they tend to be fairly large, fairly spacious, and they basically allow you to house 5, 6 times the number of people in fairly spacious surroundings affordably. And we don't have that in Canada. As I
Hmm.
mentioned, I think earlier on in the podcast, you have Toronto is very built up within these sort of 4 streets. And then the rest of it is just very low density, the odd apartment or high rise here and there. But there's none of this sort of intermediate type of housing that would be, you could have ownership as a condo and also allow more density, but more people to own something, which seems to be a preference in Canada anyway.
You've identified a lot of conundrums here, and we will wrap it up. But here's some of the main takeaways that I have, and you can let me know if I've missed anything. So we've got a pretty large emerging problem in Ontario with the fact that their economy was much more was hit much more hard. We also have a problem with the issue of high housing prices, which is going to be a difficulty in attracting that sort of young workforce there. At the same time, we've got lots of additional spending that took place at the provincial and federal level, which is leading to a debt burden that's going to cost more money in order to address it with interest charges and so forth. At the same time, we've identified we need to do a greater reinvestment in testing capacity and hospital bed capacity so that we can, and perhaps even looking at increasing long-term care bed capacity. It's certainly designed if we're going to avoid the same kind of outcomes that we had last time. This is a real conundrum. Do you have some hope that we can end on?
Well, you know what? I think people are more resilient than we give them credit for, and I think we'll be able to solve these problems somehow. And I think it's important to start off by having the discussion rather than burying your head in the sand and saying that there is no problem. Canada, Ontario, all the provinces face a lot of challenges, and I mean, I suppose you could say, well, we wouldn't want a future without challenges for our grandchildren. However, it would be nice to, give them a leg up in meeting those challenges, whether it's through the educational system or the opportunity to buy a house. So I think we do have to deal with this, and I think we will. Canada is a very wealthy country. Canada is a developed country. Canada is got a lot of potential. And I think we can meet these challenges, and we're going to have to try and be as imaginative as possible in doing so. And we also have to, in a sense, have a will to want to do so. And that might require more people, getting involved in their communities, whether it's, government running for their councils, just, providing input rather than simply, putting blinders on and focusing on their day-to-day lives. It's probably time to take more of an interest.
Well, thank you so much for the conversation today. I sure appreciate it.
My pleasure, Danielle. Have a great day.
You too. My guest has been Livio Di Matteo, professor of economics at Lakehead University. We hope you enjoyed today's episode. If you like what you heard, be sure to subscribe on YouTube and wherever you stream your podcasts. And to stream old episodes, learn more about the show, and where to subscribe and submit your questions for future guests, visit fraserforum.org.